I'm Dr. Trevor Haynes. I'm a podiatrist practicing in the Portland, Oregon area, and today I would like to speak to you and show you a little bit about shockwave therapy. So shockwave therapy is an FDA-cleared technology proven to help increase the rate of healing for soft tissue tendinopathy. It is an advanced, non-invasive, and highly effective treatment method that enhances the blood circulation and accelerates the healing process, causing damaged tissue to gradually regenerate. Shockwave therapy can be used to treat plantar fasciitis, Achilles tendonitis, as well as any other forms of tendonitis in the foot or ankle, shin splints, exercise-induced compartment syndrome, wounds, non-unions of bones, as well as Morton's neuromas. So I'm sure your next question would be, how does it work? So when you experience chronic pain in your foot or ankle, your body no longer recognizes that there is an injury to the area, and as a result it shuts down the healing process, and you no longer feel relief. So the way shockwave works is that the ballistic waves, these sound waves that provide the therapy, penetrate deep through the soft tissues, causing micro trauma and an inflammatory condition to the area. Once this occurs, your body's natural healing process kicks in. And the energy emitted also causes the cells in the soft tissues to release some biochemicals that also intensifies the body's natural healing response. These biochemicals also allow for the building of an array of new microscopic blood vessels in the soft tissue. Studies show that shockwave can be anywhere from 72 to 80% effective, and there are over 20 years of data that can demonstrate this. Shockwave is administered typically only once a week. 4 to 6 treatments are usually what are needed to help the pain that you are experiencing. All treatments are performed by our experienced staff or the doctor. And what happens is this applicator here is applied to the painful area, and these ballistic waves are applied to the painful area. We then move this in a circular, slow fashion during the treatment. Now there may be some minor discomfort, but for the most part this is a very non-painful treatment. So shockwave has a proven success rate that is equal to other traditional methods without surgery, without the risks, without the complications, and without all the recovery. There's no incisions, no anesthesia. The difference between our radial shockwave and high-frequency shockwave is that high-frequency shockwave is typically very painful and requires anesthesia. With radial shockwave, you can be active right after treatment. You can resume normal activities the same day. And while some patients may notice significant relief after the first treatment, many will notice it over a gradual period of time. So how does shockwave compare to physical therapy? Well, physical therapy is typically 2 to 3 times a week, for about 6 weeks, and each session takes about an hour. If you have a $40 copay over that 6-week period and 15 appointments, you're going to end up spending over $600 and spend over 15 hours of your time getting this treatment. With shockwave, we typically charge $100 a treatment. So for 6 treatments, each 1 week apart, for that same 6-week period, you'll spend about $600, which is about the same, but only spend an hour of your time with very similar, if not better, results. There are very few side effects associated with shockwave therapy. In some cases, you may experience some bruising or some soreness to the area. Some of the recommendations that we have for shockwave is that prior to any treatment, you discontinue any ibuprofen or NSAIDs 1 day prior. And then we recommend for the next 4 days following the treatment that you do not ice the area or take any further NSAIDs or ibuprofen, as that will defeat the inflammatory process that the shockwave creates. So let me show you a little bit about our machine. This is our Impulse shockwave machine. You can see our monitor here. We can adjust here the millijoules, or the energy that we use on the tissues. We can also adjust the hertz, which is the frequency used. And then we can also adjust the number of pulses that we use. And we can do continuous pulses, we can do bursts, there's different types of pulses we can do. So typically a beginning one that we like to use is 110 millijoules, 11 hertz, and for somewhere between 2,500 and 3,000 pulses. And the way we do this is we usually get something like a gel, or what we use here in our office is a small CBD rub. And we'll just put it on my hand here for an example. Say I've got some issues with some pain right there. I'll put this little CBD rub on there. And then we get this guy right on the area. And we just start with the pulses. And as you can see, it's not painful. It doesn't hurt at all. Likely won't need to take anything for pain afterwards. If you do need something, Tylenol is more than enough for the pain, but most patients do not take anything for the pain. So again, we have this available in our offices. It's great for a lot of treatments that we do. We use it on wounds. We've used it to heal non-unions. But mainly it's used for a lot of things like plantar fasciitis and Achilles tendinopathies. So if you've got problems with either one of these, feel free to give us a call, come in and see us, and we'll get you set up with some Shockwave and get you back on your feet.